you.
Sorry, Bok. Magku-queue po ako sa inyo via private chat.
Saan? Sa
Dito
FB?
sa
Messenger?
sa StreamYard po. Private chat lang.
Sorry. I can't read StreamYard chat. I'm using a phone eh.
Sorry, sir.
I can't read the StreamYard chat. I'm using a phone for StreamYard eh.
Okay.
Normally I get it
Messenger na lang daw.
through FB Messenger eh. Sorry, Bok. That's what.
Sige, sir.
Sorry.
Try na lang natin sa Messenger, sir.
Roger. Nag-message ako
Okay.
sa'yo ngayon doon. Good evening. I'm Ed Lingao. The big stories tonight. After receiving a mouthful from President Duterte during his address Monday night, Vice President Lenny Robredo, with a smiling emoji, tells the chief executive that spraying pesticide all over the country and waiting on a vaccine, among others, will not make for a good response to the pandemic. With a turnover in House leadership just weeks away, the supermajority in Congress supposedly prefers Speaker Alan Peter Cayetano over Lord Alan Velasco, at least according to one of Cayetano's close allies. Columnist Tulfo and former Justice Secretary Vitaliano Aguirre trade barbs during the Senate's probe into the Pastillas scheme. The NBI's legal assistance chief was also arrested for accepting bribes from the racket. 1,500 Filipino health workers may have been given the go signal to fly abroad, but as for the total lifting of the deployment ban for medical professionals, that may be far-fetched, according to the palace. And not that you'd want to get infected, but dengue might just be the missing link to finding a cure against COVID-19. We begin tonight with yet another diatribe from President Duterte against his critics for taking a swipe at the administration's COVID-19 response. The special mention, Vice President Lenny Robredo. Maricel Halili with the big story.
Alam mo, Lenny, kung gusto mo, if you really want to do away with the COVID, isprehan natin itong Pilipinas o Manila ng pesticide galing sa eroplano para patay lahat.
That was the sarcastic response of President Duterte to Vice President Lenny Robredo's comments on the government's handling of the COVID-19 pandemic. In his taped public address on Monday evening, Duterte insisted that the administration has been doing everything to address the health crisis.
Huwag na ninyong palakihin ang problema. Do not add something to the pandemic by making such reckless statements that we are not doing enough.
His spokesman Harry Roque said Robredo and other members of the opposition have already turned blind despite the improvement on isolation centers and testing capacity, among others. Vice President Lenny Robredo earlier expressed displeasure over the efforts to dump dolomite along Manila Bay. This, she said, as the government grapples to fund the country's COVID-19 response. President Duterte brushed off these remarks and instead congratulated Environment Secretary Roy Simato for doing the job. The temporary opening of Manila Bay over the weekend resulted in overcrowding, making it impossible for onlookers to observe physical distancing.
Now people now are really enjoying the reclaimed area with the white sand, maski na papano.
Also during his speech, the president explained his reason for allowing more health professionals to live and work abroad. Still, he appealed to them.
Sana yung iba naman will have the spirit and the fervor to serve the Filipino people, because we also need help and we have a crisis also to deal with.
President Duterte also took the time to acknowledge the efforts of the Office of the Ombudsman to prosecute erring officials of PhilHealth. For News 5, Maricel Haridi, we are One News.
VP Leni Robredo also clapped back at President Duterte. In a Facebook post, Robredo says the availability of hospitals, beds, and funeral homes would not suffice in the battle against COVID-19. Waiting for a COVID-19 vaccine, which may take years, is not an option either, she stressed. The VP said the pandemic should be addressed with medical and non-medical interventions, overcoming humanitarian emergencies, restructuring public and private finances, and rebuilding the economy. As for the president's suggestion to spray pesticide across Metro Manila via an airplane, that too will not cut it, says Robredo. Medical experts warn that it might be too early to cheer the continuous decline in new COVID-19 infections in the country. This, as severe and critical cases have been seeing a steady rise. Greg Gregorio with the figures.
The country is experiencing a decreasing trend of new COVID-19 cases according to the data of the Health Department. From a 7-day moving average of 3,300 new cases back in August, infections have dropped significantly to 2,800 in early September. But the fight is far from over. Philippine College of Physicians Vice President Dr. Maricar Limpin noted an increase in the number of severe and critical cases. Those considered severe develop respiratory illnesses like pneumonia, while critical patients are those in need of life support such as intubation. Over the past 2 weeks, the percentage of severe cases is at around 1.1 to 1.4%, while critical cases doubled from 1.6% to 3.3%. While more patients are receiving treatment, Dr. Limpin said many only seek medical help during the later stage of their condition.
Sila po ang magsasabi sa atin kung mukhang COVID-19. At kung mukhang COVID-19, maaari hong magawan na ho kayo ng mga nararapat na mga test na kailangan gawin. At kung kailangan naman ho kayong ma-admit sa ospital, then i-refer ho kayo kaagad sa ospital for admission.
The new trend in the country's cases cannot be quickly attributed to the new strain of the virus, says the Philippine Society for Microbiology and Infectious Diseases. Recall that back in August, a new variant of the SARS-CoV-2 has been reported in the Philippines.
Increased transmission lang ang sinasabi sa literature, but whether it's associated with increased severity, hindi pa natin alam yan.
Medical experts also oppose the use of hydroxychloroquine as prophylaxis against the virus. This after the group concerned doctors and citizens of the Philippines called on the government to lift all lockdown measures and use prophylaxis on individuals instead. Dr. Alejandria said that even the previous WHO Solidarity trial for the use of the off-label drug has not shown any benefit.
Worse is there are more side effects among those patients given hydroxychloroquine, 40% versus 16.8%. So ano yung mga side effects na naramdaman? Nausea, vomiting, diarrhea, abdominal pain, pagkahilo, headache.
The country is certain for medical groups. The country cannot loosen its community quarantine measures just yet. For News 5, Greg Gregorio, we are One News.
The palace says there is a possibility that the president will issue an executive order to set a price cap on RT-PCR tests as recommended by the Health Department. Presidential spokesman Harry Roque says this is possible considering that the president previously released an EO to control the prices of medicines amid the pandemic. For the meantime, the palace released a list of 15 hospitals that currently offer RT-PCR tests between 1,750 pesos and 2,000 pesos. Roque also called on hospitals offering RT-PCR tests, which is regarded as the gold standard in COVID-19 detection, to not prioritize profit in this time of crisis.
Napakadaming laboratories. Gobyerno po ang nag-donate o kaya pribadong sektor ang nag-donate ng makina at mga test kits. Ibaba nyo po ang mga presyo. Alam ko po may mga nagnanais sa inyo, bagamat non-profit kayo, na kumita. Wag naman po. Ibigay na po natin sa taong bayan yung benepisyo pagka kayo po ay nakatanggap ng libreng makina galing sa gobyerno o sa pribadong sektor o mga libreng mga testing kits.
The Department of Science and Technology has named the 13 hospitals that will take part in the World Health Organization's COVID-19 solidarity trials. According to Science Secretary Fortunato de la Peña, the Interagency Task Force has accepted their recommendation for the zoning of the solidarity trials. The 13 health facilities comprise 8 trial zones. In Metro Manila, these are the Philippine General Hospital, Manila Doctors Hospital, San Lazaro, the Lung Center of the Philippines, St. Luke's Medical Center in Quezon City, the Research Institute for Tropical Medicine, Makati Medical Center, the Medical City, and St. Luke's Medical Center in BGC. While in the provinces, the hospitals that will facilitate the study are the Vicente Soto Memorial Medical Center and the Chonghua Hospital, both in Cebu City, the De La Salle Health Sciences Institute in Cavite, and the Southern Philippines Medical Center in Davao City. Vaccine recipients will be drafted from barangays with the highest COVID-19 cases. 38 candidate vaccines will be tested in the clinical trial that is expected to begin next month. When the big story returns, the squabble in the House of Representatives continues, with a number of lawmakers wanting to defer the Duterte brokered term-sharing deal. Columnist Tulfo and former Justice Secretary Vitaliano Aguirre lock horns yet again. The word war after the break. I'm Ed Lingao, and you're watching The Big Story. Amid the House leadership squabble, House Speaker Alan Peter Cayetano says he will not be pushed around. But that may not be necessary, as one of his allies thinks that the odds are in his favor. Mariana Enriquez tells us why.
The supermajority in Congress want House Speaker Alan Peter Cayetano to stay in his post despite a term-sharing deal with Marinduque Representative Lord Alan Velasco, at least according to one of Cayetano's staunch allies. By late October, Velasco is expected to take over Cayetano, who by then has served for 15 months as House Speaker. Velasco will lead the Congress for the remaining 21 months. Deputy Speaker El Rey Villafuerte is afraid that Velasco's supporters are outnumbered.
Over 200 congressmen would want Speaker Cayetano to continue. Kasi if you will talk to the party heads, like ako, nationalista, 54 kami, ang National Unity Party, solid behind him. Then of course, si Majority Leader Martin, who's from Lakas, is supportive. Mga party list groups are supportive. So kung bibilangin natin, even PDP laban, most of them are supportive of Speaker Alan.
Villafuerte says, above all, Cayetano is enjoying the public support, noting that Congress has received its highest trust rating ever since Cayetano took office. Palace spokesman Harry Roque says President Rodrigo Duterte is hopeful that both Velasco and Cayetano will honor the very deal that he brokered. But Roque warns he cannot do anything if Velasco lacks supporters.
Ultimately, the decision will be the decision of the individual congressmen. Kung walang numero si Lord Alan, wala akong magagawa.
Capiz Congressman Ferdinand Castro, meanwhile, doubts Velasco's leadership.
Kung Velasco showed his true self, he did not work, he did not contribute, he did not defend this house, he did not lead. So I would expect us to follow him. It was his mistake to think that he could just do nothing but within 15 months and then just one day appear in Congress to claim the speakership as if it was his birthright.
Villafuerte shares Castro's sentiments.
After nagkaroon ng SONA na sinabi siya ang he will assume after 15 months, we never heard we've never heard from him. On all the major issues, we did not hear from him.
Villafuerte and Castro also stressed that with the uphill battle against COVID-19, now is not the time to talk about changes in the House leadership. As for Cayetano, he says allegations that he favors some districts for next year's budget are meant to unseat him as House Speaker. But he says if the majority wants him out, then so be it. Otherwise, no one can push him around. For News 5, Marian Enriquez, we are One News.
House Minority Leader Benny Abante favors delaying the term-sharing deal in Congress. In an interview with 1PH's Sa Totoo Lang, Abante says it would be better not to change leadership in the lower chamber while the country is still dealing with the pandemic.
Because of this pandemic, it is wise not to change leadership. No? Hindi naman natin akalain may pandemic So iniisip ko, sa pandemic na ito, mas okay siguro na manatili muna yung leadership, no? Bago magbago yan. Not because of anything else, but because of the crisis that we are having right now.
Former Justice Secretary Vitaliano Aguirre and columnist Mon Tulfo traded insults during a Senate probe into the Pastillas scheme at the Immigration Bureau. Mian Los Baños shares with us what went on in that hearing.
On Tuesday's Senate hearing, columnist Mon Tulfo showed the Committee on Women and Children videos and pictures of helicopters which allegedly landed a couple of times in Mulanay, Quezon, the hometown of former Justice Secretary Vitaliano Aguirre. This, he says, is proof that Aguirre is the protector of the Pastillas scheme at the Bureau of Immigration.
Look, yung pong bilog na pula, yung mga duffel bags. Mga duffel bags po, na ang paniniwala po ng mga tao sa Mulanay ay pera. Yung pong isa, yung po yung bag ni Secretary Aguirre, Burgos Bariata.
The Pastillas scheme is a bribing tactic used by several immigration officers to allow illegal POGO workers from China to enter the country. Tulfo alleged that immigration officers paid visits to Aguirre in Quezon around 3 to 5 times a month. But the former Justice Secretary said Tulfo's allegations are without basis and are only meant to besmirch his name. He added that if he is indeed receiving payoff, he would have done it discreetly and not use a helicopter.
Bakit naman, Mon Tulfo? Doon ko pa dadali ng pera sa Mulanay at para makita ng mga usisera at mga usiserong tao para ipagbandila o ipagyabang ko sa Mulanay na nandito yung pera sa akin. Dapat ililihim mo.
The two got into a heated exchange during the hearing, with Committee Chairman Senator Risa Ontiveros serving as the referee.
Madam Chair, sinungaling yan. That's it. Kaya nga siguro inalis ni Pangulong Digong yan. Hindi po ako inalis. I resigned. No. You were gentleman. You had to. You were told to resign. I was never told to resign. ba't ka inalis?
Tama na lahat ng resource persons dahil pwede ko pa sana ipagpatuloy yung hearing mula sa inyo kung susundin nyo yung sinabi ng chair na i-address yung chair at ating
The two used to be friends but took a turn when the former Justice Secretary did not grant Tulfo's request that the libel cases against him be consolidated. In the hearing, Alex Chong, who is the main witness in the issue, also confirmed that all the 19 immigration officers charged by the NBI were part of the Pastillas scheme. But he said the bosses or the leaders of this scheme were not included in the list of those charged. Among them is alleged leader, former Immigration Deputy Commissioner Mark Red Marinas. Aguirre admitted entrusting Marinas with the post but repeatedly denied any knowledge of the so-called Pastillas scheme. The NBI meanwhile admitted that it arrested the head of its own Legal Assistance Bureau, Attorney Joshua Paul Capiral, after he was caught receiving bribe to clear some of the names involved in the Pastillas scheme. Reporting for News 5, Mean Los Baños, we are One News.
And here are the other big stories today. Baguio City was supposed to open its borders to tourists today, but rescheduled it instead to October 1st. According to Baguio City Mayor Benjamin Magalong, they will take this time to address the recent uptick in COVID-19 cases in some of their barangays. The summer capital, however, has launched Visita, its online registration site, where tourists can submit requirements before trying to enter Baguio City. The Office of the Ombudsman expressed dismay after the Department of Budget and Management cut their 2021 funds by over 20%. The agency proposed a 4.6 million pesos spending plan, but was only allotted 3.6 billion pesos. Sorry, that's billion. During the House deliberation, Ombudsman Samuel Martinez also admitted that they have not been conducting lifestyle checks. There are now guidelines restricting access to salons of government officials. Let's pause for a short break. When we come back, a total lifting of the deployment ban on medical workers will not be happening anytime soon, says the palace. And what answer does dengue hold in the quest for a cure against COVID-19? The groundbreaking research next. I'm Ed Lingao, and you're watching The Big Story. While more Pinoy healthcare workers can now work overseas, the palace says that they might not totally lift the deployment ban while the country is under a state of calamity. Jenny Tongon tells us why in this report.
Jordan was supposed to start working as a nurse in the United Kingdom last September 18, but because of the government-issued deployment ban on healthcare workers, his dream had to be put on hold. Jordan said he has already spent more than 100,000 pesos to complete his requirements.
Noong una, talagang sige, tanggap namin, okay, kailangan tayo ng Pilipinas, kailangan tayo ng gobyerno para magsilbi sa bayan. Pero as time goes by, parang naiipit kami. Hindi nila kami masisisi sa aming pag-abroad kung ang dahilan nito ay para lang may maihain sa pagkainan ng aming mga pamilya.
In his 5 years of working as a nurse in the Philippines, Jordan had only received a salary of 20,000 pesos per month. He said he decided to apply as a nurse in the UK as he would be earning 10 times as much. That's why Jordan could not hide his excitement upon learning that he is among health workers qualified to live and work abroad. President Duterte has allowed 1,500 health workers whose documents have been completed as of August 31 to live and work overseas.
Yung iba, maghintay-hintay muna kayo sandali. Kinakalibrate lang natin yung paglabas ng mga, kasi kailangan din natin yung mga tao.
Presidential spokesperson Harry Roque said that while the government is under the state of calamity, the government will have a hard time to totally lift the deployment ban. He said the ban is not only meant to address the lack of medical personnel in the country, but also a way for the government to protect them. But Philippine Nurses Association Secretary General Jocelyn Andamo says relatively few health workers stand to benefit from this. She also insisted that there are enough practitioners in the country.
Partial victory para sa mga nurses, mga affected nurses na matagal nang nakikipaglaban para mapayagan silang makaalis at makapagtrabaho abroad. Mayroon pa tayong natitira na hindi bababa sa 240,000 nurses. So, kung sinasabi na kailangan nating tumulong sa pandemya, we have enough nurses waiting to be maximized and tapped by the government.
Andamo added that health workers should not be blamed for seeking better opportunities abroad. She says if the government really wants them to stay, they should be provided competitive salaries and benefits. For News 5, Jerry Dongon, We Are One News.
In order to help his parents with expenses in the upcoming school year, a kid from Quezon City sells rags woven with his own hands to buy a gadget for online classes. His inspiring story in this report by JC Cosico.
With only a few weeks before the reopening of classes, some students are maximizing their time to rest and play. But spare this kid from Barangay Payatas in Quezon City. 9-year-old Gilbert Eboy Bandillo makes the most of the prolonged school break of weaving and selling rags. His goal? To save up for a gadget which he will use once online classes begin.
Para po may message kami para kung hindi namin alam yung subject nila.
Eboy, an incoming grade 4 student at the Melencio Castelo Elementary School, learned to weave rags when he was just 7 years old. His 56-year-old grandmother Angelita, who runs a small sari-sari store, taught him to do so. Each rag costs 25 pesos to 45 pesos, depending on the size and design.
Hindi na katulad dati na kahit ganyan lang yung paninda ko, konti lang, pero mabilis ko mapaikot, sir, kasi mabilis ko lang maibenta. Ngayon, matumal talaga, sir. Walang pira mga tao, sir, eh. Mahirapan kaming bumili ng sarili nilang gadget kasi iinuna nga namin pagkain namin.
Eboy's father, who works as a tricycle driver, admits they could not afford to buy a gadget for his son.
Mahina po yung aming pasada ngayon sa tricycle. Gawa nga po nung pandemic, no? Tapos alternate po yung biyahe namin.
Some of Eboy's neighbors offered help by selling their rags online, just like Abigail, who said customers are satisfied with the products.
Ayokong kaawaan yung bata. Kasi yung bata, kahit siya pag sinasabi, Tita Abby, hindi naman tayo mukhang kawawa dun, di ba? Hindi naman tayo nagpapaawa. Gusto ko lang pakita na gumagawa akong basahan. Marunong akong dumiskarte. Yun lang naman gusto ko eh.
Eboy has a message to kids his age.
Dapat po, hindi po sila gala ng gala. Kasi lalo na po ngayon may COVID-19 po. Kailangan po nilang dumiskarte para hindi po sila hingi po sa magulang nila.
The Education Department has time and again said that gadgets are not required under the distance learning setup. It cited other learning modalities such as printed modules, radio, and TV. To those who want to order Eboy's products, they may visit their Instagram page at Angels Rags. For News 5, JC Cosico, We Are One News.
Now, what if someone told you that dengue might just hold the key to finding a cure against COVID-19? That seems to be the thesis of this yet unpublished study shared exclusively to Reuters news agency. The study suggests that exposure to dengue may just provide some level of immunity against COVID-19. Reuters reports that the groundbreaking research led by Duke University professor Miguel Nicolelis showed a link between the spread of the coronavirus in Brazil and past outbreaks of dengue. By comparing the geographic distribution of COVID-19 and dengue cases this year and in 2019, the research team found that places with lower COVID infection rates are areas that suffered intense dengue outbreaks. If proven, this could mean that dengue infection or immunization with a safe dengue vaccine could provide some levels of immunization against the coronavirus. And that wraps up today's big story. Catch us again tomorrow at 8 p.m. on Signals Channel 8 or 250. So please like our Facebook page, One News. For more in-depth analysis, visit our webpage, onenews.ph. I'm Ed Lingal. We are One News. Good evening.
Oh, sir, kumusta na kayo dyan? Magulo pa rin. At saan po ang house?